Hello, everyone, and welcome to another edition of Sustaining Sustainability. I'm your host, CB Bhattacharya, and today I'm joined by Astrid Haas from Kampala, Uganda. She's the Policy Director at the International Growth Center, a global civil society organization that promotes sustainable growth in developing countries. An urban economist by training, Astrid works with city government officials across Africa and Asia to support research and evidence-based policy reform. Astrid, welcome to the program.
Thank you for having me, CB. It's a pleasure to be here.
So, Astrid, we're talking to people from around the world. Can you give us a sense of what the situation is like in Kampala, Uganda, as a result of the global pandemic?
Interestingly, here in Uganda, we started responding before we'd had the first recorded case. So our first recorded case was on the 22nd of March, but already before that, we'd had health checks at airports. We'd already started banning large public gatherings. And that's because I think it's important to note that our reference point for a health crisis is Ebola. We've had a number of sort of outbreaks in the recent past in our vicinity. And so even when you think about the last time I traveled, the form I filled out was very much still the sort of forms looking at Ebola symptoms. Then we took a very strong approach as soon as the first recorded case came in, banning public transportations. And since the 1st of April, we've been on a full lockdown that was initially supposed to last for 21 days, then was extended a further 14 days, and now has been extended again by 14 days. And as I said tonight, we await what is going to happen. The interesting part about this is we've only had 227 recorded cases so far and no deaths. So in terms of the health crisis, we don't see the same infection rates, at least as what we can tell by our testing, as we see in other places. But we have had a lot of struggles associated with the containment measures. In some cases, that has affected lives in ways that resemble what a health crisis should probably prevent to do.
So are there any kinds of local actions that you're seeing in Kampala or other cities in the global south that seem to stand out from those you've seen implemented in Western European countries or in the United States?
So quite honestly, I think the challenge is that we don't see the local tailoring of policy measures. In fact, we see much more a mimicry of the sort of full lockdown measures first implemented, I think, in China, then, moving to Europe and then parts of the US, where we take full lockdown. And as I sort of noted it's in some ways even more stringent than what is seen in other places. I think the big difference, however, is the fiscal ability that we have here for the government to provide support. Even prior to our lockdown or prior to this pandemic, there wasn't very much social protection measures in place. In fact, actually very, very limited social protection. And now with a closing fiscal space and potentially, a lot of people worrying about an imminent debt crisis, it's impossible for the government to come out with new social protection measures. So whilst you see, for example, in Europe and the US that the commensurate response to the lockdown is sort of large funding packages from the government to support those who are vulnerable, we don't have the ability to do that. Thus, the vulnerable are left a lot more exposed.
You've also written recently about the challenges to implementing a total lockdown in many countries in Africa. Could you tell us a little bit more about why that's a taller order in some economies than in others?
It's easier to dish out advice than it is to have to implement the policies. And so I think policymakers around the world faced with incredible uncertainty have had and not very much data or evidence to work on, have had to make very quick and fast decisions. So, I don't disregard the sort of initial lockdown was perhaps necessary, both in terms of the uncertainty. We needed to provide shock value to highlight the intensity of the problem. Our health systems are far weaker across the continent than they are anywhere in the US and in the EU. And as we saw those health systems strain under the sort of number of COVID responses, we knew that it would, with a similar infection rate, our health systems would collapse, right? So for example, here in Uganda, I think it's a bit of a disputed figure, but there's only approximately 70 ICU beds across the whole country. And that's not 70 ICU beds that are currently lying idle. Those are just the total number of beds across the whole country. So we couldn't have and we can't sustain an infection rate like is being seen in some other places without our health system collapsing. That being said, the economies across the continent, and of course I'm very cognizant that I'm generalizing right now, but in general, one of the challenges is that a large percentage of the people live not in the formal economy. So when we think about, for example, African cities, 85% of people don't earn a wage, but rather rely on day-to-day interactions and day-to-day existence. So if you think about the typical firm, the World Bank did a survey of the informal sector in Kampala in 2016. 82% of those working in the informal sector were sort of in trading and in services that required some sort of interaction. 69% of those firms had an annual turnover of less than $2,600. 59% of those firms were one person only, so just as, self-employed people. And I think what's really important to note at that point already, so this is in 2016, 93% of the firms operating in the informal sector were operating close to the poverty line. Now, through the lockdown, we've removed the ability of anyone to sort of earn an income. And by removing the ability to earn an income when you are living in a city and reliant on the urban food market, and I should add that there's also indications that food prices are rising due to sort of disruptions in supply chain, it means that we've removed the ability for people to eat food. And I think some sort of very telling analysis that colleagues of mine at the IGC have done is that, and simulations of containment measures, is that an 8-week containment measure means that an extra 9.1% across the continent have fallen into extreme poverty. 65% of those were just purely due to lockdown measures. And 168 million people cannot afford their pre-COVID-19 consumption levels. And you got to imagine that's just with an 8-week lockdown. We don't know when the first vaccine will be available. Predictions are 18 months from now. So the question is what happens in between then?
So let's talk about how we can leverage what we're learning now to build a more resilient future on a global scale. Now, you've written recently about COVID-19 and challenges in urban areas in Africa. So what would you like our listeners to know about the challenges that many African cities are facing when it comes to tackling this crisis as a result of challenges or inequalities that kind of predate the current crisis?
I think it's important to note that urbanization is one of the single biggest opportunities that present itself for economic development for the continent. Africa is currently the fastest urbanizing place in the world, and there's no country that to date has developed without urbanizing. And I think there are predictions that about in the next 20 to 30 years, 2/3 of Africa's urbanization is still yet to happen. So there is a major opportunity. I think one thing that is very noteworthy in terms of this particular pandemic is that in absence of a vaccine, the two sort of biggest measures that we have in place to prevent transmission is social distancing and hand washing. But when we think about the infrastructure, for example, my own city, Kampala, about 71% of households share a single room. And that makes social distancing sort of a far reach. At the same time, only across Africa, I think the urban population, only 56% have access to piped water and can spend up to 30 minutes sourcing it. So in that sense, the infrastructure to be able to have 20-second frequent hand washing is just not something that is doable in the context that we're urbanizing in right now. And so therefore, we need to really think about the infrastructure that we need to put in place, both in terms of managing pandemics or even contagion like we see like right now, but also in terms of preventing it in the future. Because, if you think about the last few pandemics, they've all started in urban centers. And, as we urbanize more quickly and there's a sort of rise in affluence, that may also, cause a rise in meat consumption, which has been the source of both this pandemic, or at least the predicted source in others. So, we need to have the infrastructure in place to tackle it. And so I think in some senses, it's important that we both think about the cities that we have now, but the 2/3 of cities that are still to be built, and ensure that we make the infrastructure investments, particularly including water pipes and sewage lines, before people settle, because it becomes a lot more expensive once people have settled. And at that point, people live in as has been shown sort of with current African cities, if they don't settle in a planned and managed way, it can result in sort of mega slums where people live in very dense and unhygienic circumstances.
So what role do you see for the private sector, including multinational companies, in helping to close these gaps that you just mentioned and address these issues, not only as a way to stabilize the current situation, but really in terms of a long-term recovery for a more equitable future?
It's not going to be done without the private sector. I mean, even before the current economic crisis, the funding gap, I think, across Africa for infrastructure is about 68 to 108 billion US dollars per year. I think this is African Development Bank predictions. Just for Uganda, it's 1.4 billion US dollars per year. That is immense. That's not going to be covered by public sector funds. And it's not going to be covered by overseas development assistance. And particularly now, as we go in a global economic crisis, both of these sources are going to be even less. So we need to tap into private sector sources. One of the pieces that I've been looking at in my research is the potential for public-private partnerships as a procurement model that can bring the private sector in to take some of the sort of responsibility and risk to deliver infrastructure. I think it's very important to note that it's not a silver bullet type procurement model for all infrastructure. And I'm not saying that, it can bring benefits everywhere, but I think where the private sector really can have added values where, there's projects where they can bring in innovation and efficiencies, but also projects where, they generate a revenue stream. So for example, a toll road that can be then used to repay the investment in the future. And this is something that Africa across the continent has used very little of so far. So PPPs, I think according to World Bank estimates, there's only 335 projects between 1993 and 2018. I don't know what the statistics are for the US, but I'd predict that that's probably just a fraction for what, the number of public-private partnerships in the US. So I think there's real potential there to really have the private sector support infrastructure investments overall.
Any specific areas beyond what you mentioned right now where you think industry partners could actually support developing country governments such as yours in responding to the COVID-19 crisis?
I do believe very strongly that COVID-19 is a collective action challenge, and therefore we need a collective action response that involves the private sector. And one particular private sector actor that I'm going to pick on that I think is very important for developing countries, particularly in Africa, is the telecommunications industry. Not only because it's one of the sort of biggest industries in Africa, it's actually, I read in the paper this weekend, it's actually one of the industries that seems to be expanding its business during its time and actually growing its revenue as people use more data volume and voice data as well. And so I think just three quick roles that I think the mobile phone industry can help us play. So one is help us identify networks of people. And this is really important in sort of identifying super spreaders. And this is, when we think about a targeted response, when we move away from total lockdown, we're going to need to know where the virus originated and who's spreading it to be able to target that. Obviously, there's a lot of privacy concerns and considerations around this. And so, we need to really think about sort of the emergency measures, but also the sort of privacy pieces that can be put in place so that can be done properly. I think secondly, there's a social protection element. There's a lot of interesting research that was being done actually before the crisis, but is now sort of being accelerated during the crisis, that looks at how you can use, mobile phone information to understand who is vulnerable. This is really important in developing countries where we don't have the ability to, for example, pick up on tax registers or any other sort of administrative data that would allow us to highlight who is poor. And particularly important for a crisis like this, where a lot of people are becoming poor very quickly over a number, every day. And so there's ways that, researchers are looking at sort of machine learning algorithms that look at, for example, mobile money balances or the amount of calls you do and how long you do the calls to see how you can understand whether and who is falling into poverty. Thirdly, I think there's interesting case studies that some of Africa's richest entrepreneurs, come from the telecoms industry. One is Strive Masiwa from Zimbabwe. His foundation has been doing a lot in terms of the COVID response in Zimbabwe itself, but I think a really interesting project is that he's been tasked by the AU and is financing developing a digital procurement mechanism that will allow African governments to pool their resources and negotiate better rates for things like PPE equipment. It's been the case that any one government may have volumes of orders that are too low and either face prices that are too high or higher, but allowing them to sort of pool their resources and negotiate better contracts, I think, will be key.
What call to action would you make to our individuals who are listening into the program? What advice would you also give to them, given your expertise?
I think my biggest piece of advice right now is we face a collective action problem that requires a response at a global scale. And that response doesn't seem to be as forthcoming or as quickly forthcoming as we hoped. But I think, as we now move into the next phase post-lockdown of the COVID-19 response, I think it's really important to think about what resources there are and how we deploy those resources, particularly when a vaccine gets developed. I think thinking about how we can ensure that the vaccine not only gets procured for developed countries, but that developing countries have access to that too, and that supply chains work such that we are able to both produce the vaccine at a sufficient scale, but also distribute it and target it in the right places.
Astrid Haas, thank you so much for joining us today.
Thank you very much for having me.
And this is your host, CB Bhattacharya, signing off. Please join us next week for another edition of Sustaining Sustainability. This podcast is made possible by the help of my colleagues, Leslie Marshall, who's the Associate Director of the Center for Sustainable Business, and Alyssa Martinec, who is the Sustainability Coordinator of the Center for Sustainable Business. I'm your host, CB Bhattacharya, and I look forward to seeing you next week. Bye-bye.